My name is Mark Foreman. I'm a Vietnam veteran. I was wounded in Vietnam in 1968. I was a Navy corpsman attached to the Marines. I spent the next 50 years going to the VA hospital for treatment, extra surgeries because I got a horrible infection from Vietnam. And I'm here today to say that from the perspective of a veteran going to the VA hospital for so many years, I've seen the evolution of the VA healthcare system go from the early 1970s all the way up to the present. And in the 1970s and 80s, most Vietnam veterans stayed away from the VA hospital because they did not know what they were doing, especially when it came to post-traumatic stress disorder. And the staff at the VA hospital were overworked. The scheduling was always a mess. Some veterans would have to wait all day long just to be told that they're going to have to come back tomorrow. And when you're telling that to a veteran who is in pain, has post-traumatic stress disorder, you've got a very, very angry guy or gal. But this only went on in the 80s, or in the 70s and 80s at the VA hospital. Then in the 90s, it made a huge transition. The VA was able to hire more staff, more doctors, more nurses, clerks to handle all the scheduling. And today, it is the most advanced healthcare system possibly in the world. Now, the main reason I'm here is to let you know that in the last 10 years, there's been a major push to privatize the VA. As many of us know, there were a lot of negative reports coming out of the VA hospitals about how there was this lack of care. And of course, there's the same lack of care that's going on in private hospitals too, to a certain degree, But now the VA healthcare system has evolved into, like I said, I believe it's a world-class role model for all other hospitals and how they should be operated. But there's this new initiative that the Trump administration has put into place. They call it the Mission Act. It started with choice. They wanted to give veterans a choice if they wanted to go to private hospitals, and then they could go to private hospitals. And then it evolved into the Mission Act, which just went into effect this June 6th. And we, veterans, see it as an initiative to privatize the whole VA system so that the profits will go to the private hospitals. And we're very concerned about that, because once they start sending us out to private hospitals here and there and everywhere, it divides us. And that's exactly what they want. They don't want us to have one voice in this whole thing. So we are very opposed to the Mission Act, and the best thing any of us can do right now is to call our congressional representatives and let them know that you're very opposed to the Mission Act and to fully fund the Veterans Administration. Thank you.